Hello, everyone. This is Sevtap Savas, and I'm very excited to be with you, with our guest today. It's a really amazing experience because I was going to interview one of our guests, Mr. Derek Bishop, today. But what happened is that he had a friend on our floor at Faculty of Medicine at Memorial University. So, now that friend is also joining us. So she has an incredible legacy in genetic research in Canada, Dr. Jane Green. Welcome, Derek. Welcome, Jane. How are you today?
I'm
Good.
fine. Thank you.
That's amazing, really. So in just half an hour, we decided to do this together. So thank you for your just an amazing support today. This series is about, we are talking about cancer here. We are talking about cancer from prevention to screening to importance of hereditary cancer or genetic information, importance of research, lived experiences, and cancer services available in the province. So I think having you both in this episode is really meaningful because Jane has a lot to say about the research and other implications of research done, especially in this province, in Newfoundland and Labrador, in terms of hereditary cancers. And you, Derek, of course, is have the lived experience with hereditary cancer syndrome. So I'm really looking forward to that. And I'll start with maybe this is just an introduction, but I think it's time for us to formally ask you to introduce yourself. So, Derek, if you would like to say a couple of things about yourself, this is a good time.
My name is Derek Bishop, and I'm a resident in Newfoundland. I was born here. Lived most of my life in St. John's, but now I live in Conception Bay South, and the weather is always better out there, by the way. Uh, and yeah, so I've been involved with Dr. Green, I think since about 1992.
Woo!
I think about the first time we spoke, and I always tell people Dr. Green saved my life, and in reality, she has, and I'm sure many other people in the province as well.
That's amazing. And Jane, for you, hearing those words should be very heartwarming. Do you want to tell very briefly about yourself? I know it's a very long biography, but just give us a sense of who you are.
My name is Jane Green. I'm a medical geneticist. I grew up initially in Vancouver and studied with Dr. David Suzuki, Drosophila genetics, which was the kind of genetics possible in the 1960s. We finished, my husband was a marine biologist and got a position at the Marine Lab. And in 1968, we drove to Newfoundland. In 1972, I began working in genetics at the eye clinic. We had a hereditary eye clinic, and one day several sisters were referred, and two of them had loss of vision. They were just in their 20s and 30s, and what they had was what was called a retinal angioma. It was a blood vessel cluster on the back of the eye, which caused a retinal detachment. And so that was in their 20s and 30s. They had a brother who died of a brain tumor and others, relatives with kidney cancer. So this was my first experience with a hereditary cancer and looking at all of the different possible tumors that might be seen in the same family, looking at the ages they could occur. And then because by the time there's symptoms, there can be significant disease, whether it's loss of vision or a serious brain tumor. So it was a question of talking to all of the medical specialists about how we could find these tumors at an earlier stage and set up a screening program. So they came in on either 6-month or 1-year intervals and had investigations to try and find something early when it was treatable, but before it had caused symptoms. And so that first disease was called von Hippel-Lindau disease, but then it went on to various others, including the hereditary colon cancers and and so on. But it's always been, what can you learn from talking to the family, reviewing records with the consents from the family, talking to older relatives about the history before, and what what are you looking for, and how can you find these tumors. So some things you might have used an ultrasound initially, and then CT scans became
Mhm.
available, and then MRI, and so on. So it's an ongoing process of updating the information and the screening to try
Thank you.
and make better results for the family.
Yeah, thank you so much, Jane. You made excellent points here, from research to implementation in the clinic services, importance of early screening, early detection, and as well as the family history. So, Derek, I'm pretty sure these words actually are resonating with you. Did you want to say anything about any or all of these? Is this with you?
Well, as I said earlier, I first had contact with Dr. Green in 1992 when she called me one evening just after I finished supper. So I guess she was working late that day for sure. And she mentioned to me at that time that she was aware that my father had died from cancer some years before, and she knew all the tumors and so on that he had over the years. And Dr. Jane was aware that I had done a fair bit of uh, research on my family in terms of genealogy, and was wondering if I'd be willing to work with the medical school, medical genetics, to try to determine if there was a relationship between a family in one part of Newfoundland and my family. And so I was happy to do that. And so I worked with Dr. Sandra Luscombe that summer, and was able to actually track down the connection between the two families, which I guess helped give evidence that this was a genetic problem. Um, my father had cancer first when he was in his late 20s, and a successful surgery in 1949, which was wonderful. And he had that was a bowel cancer. And in about 1960, 61, he had developed a squamous cell carcinoma type of skin cancer on his face. And unfortunately, within a year or so, he had a primary site, I believe, in his stomach and his pancreas. And he died about 6 months after the diagnosis at the age of 43. Um, so, doctor, that was how it affected me. And of course, I was only 7 years old at the time, and it had a great, I believe, a mental health effect upon me, because I can remember, probably for even a couple of years after, when I would go to bed in the night, I would cry, thinking about my father's death, and uh, I was a bit nervous what would happen with my mother, could something happen to her, that sort of thing. And Dr. Green brought this up, and she suggested that myself and my sister be tested, and my mother as well, to see if we carried the gene. And my mother, of course, didn't. But both my sister and I, unfortunately, both carry the gene. It's an autosomal dominant gene, which basically means if the person has the gene, it will show up. So I did receive the gene from my father. The connection for the families in Newfoundland, luckily for me, and I guess for the research, I had done a fair bit of genealogy, and I was able to trace back to the 1830s, I believe, where there was actually a journal kept by an Anglican priest in one part of Newfoundland, and he described his visitation to uh, one of my ancestors, and described, this young man who was in his 20s, and it was very obvious to anybody reading. my background is nursing as well, and from reading the journal, you could pretty well tell for sure this person probably had a GI cancer, and he died at, I believe it was at 23. Um, so going right back, tracing back even to that period, well over 100 years ago, I was able to see how people in my family, some people showed up with bowel cancer, for women, endometrial cancer, pancreatic cancer, skin cancers, stomach, uh, glioblastoma type of brain tumor, bladder cancer. I'm not sure if I mentioned that one, but I did have an aunt who had that. So, and in a lifetime, generally, people had a number of cancers that they survived. And I think it brings up the importance of actually early screening because, as I mentioned earlier, Dr. Green saved my life. Uh, I was screened from 1993 up to the present, and some of the screenings did show up that I did have precancerous areas, and they were uh, dealt with at that time. So anyway, so I've been very lucky, and really, I don't think I'd be alive today if it wasn't for the research that was done and the screening that was done as well. Um,
Thank you. Thank you, Derek. This is a very powerful story in so many ways. And thank you for sharing, um, especially your dad's and the aftermath of his passing. So thank you. Um, so you demonstrated it very nicely how certain diseases, including some of the cancers, can run in the family. I think this is one of the terms that is way better known than the hereditary cancers. So, it can happen. It doesn't have to be, but it can happen, in every generation. If you trace back, you can find someone else affected by it. It doesn't mean that it's hereditary. There are other conditions as well. At this point, I want to turn to um, Jane. Jane, so in hereditary cancers, there are a couple of clinical manifestations that can alert the physicians for a hereditary cancer, for example, early age of onset, etc. Do you want to tell us about, this kind of things that even any of the folks can actually think, oh my God, is there something that I should be concerned here based on these indications? Do you want to tell us about those?
The things that family doctors or other doctors or even families themselves could be taking notice of, or if there's an early onset of cancer, if there's more than one cancer in an individual. Cancer is not uncommon. Many people will have cancer in their lifetime, but if it's not hereditary, it's more likely to be in the 60s, 70s, 80s, and so on. But in families where there is a gene that you're born with that is not working correctly, then the cancers can occur earlier because this gene is supposed to be keeping cells under control. If it's not working, then there's a chance at an early stage of a gene not working, and it is a gene that should be keeping cells dividing at a regular rate. Cancer is really when cells are dividing much too rapidly and forming tumor, which is just too many cells. And so this was in the early days, many people said everyone knows that cancer is not hereditary. I was at a big meeting of the American Society of Human Genetics back in the 1980s, and I was standing giving my talk on Derek's extended family. Just we never talk about who the family is, but just the relationship of people and the types of tumors and the age. And somebody stood up and said, everyone knows that cancer is not hereditary, and sort of stomped out of the room. Everybody else in the room was most interested to hear. And it's large families, if you have a small family and there's only one or two brothers or sisters and a parent or a grandparent did have cancer, um, it doesn't necessarily tell you a lot because it's a small sample. But if you have a large family and there's 10 or 12 brothers or sisters, and four or five or six of them had cancers, and the same number in the previous generation and the next generation, it tells you something is going on in that family that's not in most families. And then people did the studies, and the very large Newfoundland family was very helpful because in the old days, um, genes were known to exist, but there wasn't an understanding of the location of the genes. Genes are on things called chromosomes in the cells, but no one had any idea about which gene was on which chromosome and how to find out which gene might be causing um, albinism, which is a lack of pigment, or causing a bony problem or a cancer. But the large families gave you a chance to look at all the pieces and put together the information. So the large Newfoundland family, and we always referred to it, I referred to it as Family C. It was a Canadian family, and it was the family that had so much information because of the large family size and because family members were so willing for me to review their records. Because one time somebody said, "Oh, Aunt Mary had the same thing." Well, when I reviewed the records, she actually had gallbladder cancer. She'd had abdominal surgery, but it wasn't, she had gallbladder disease. She didn't actually have a cancer.
Yeah.
So being able to review things, and if I went out to the communities, the outports, they're often, I might see 10 or 12 family members, siblings, the parents, and possibly grandparents might be. In one case, for instance, you should see my grandparents. They're in the White House down the road. Now, of course, every house was white, but the community members made sure I got to the right people. And they knew history 2 or 3 generations further back. And you could put that all together and see how this family in the northwest part of Newfoundland was actually related to a family on the east coast. And then you had the large enough size to learn so much more about the types of cancers, the age of onset, and so on. And that's what allowed the development of the screening to find things early.
That's perfect. Research, collaborations with the families affected by it, and then knowledge being integrated into clinical care. This is amazing, and I know there are a lot of Newfoundland and Labrador families who have been involved in research, and some of their findings actually changed the clinical care here, including in certain cancers. So that's amazing. So with this, so I want to turn to you now, Derek. So you kept saying Jane Green saved your life, and then you mentioned about screenings and so on. So do you want to, so you had an individual with who is who has lived through hereditary conditions or cancers, right? And your story also says that it's both emotional, but also there are certain things that are helping you to keep your health on track. So I always wonder, like I always think that you don't have to answer that, but I always find that those individuals with the lived experience, these are the best teachers.
Oh, thank you for that. Um, in terms of the screening, pretty well right away, I started with the colonoscopies, which not always wasn't initially a very pleasant experience, but to the point now I look forward to it when I was working as a nurse because it was a day off. And so it didn't bother me so much. And people are scared of these things, but I think it's just the initial thought of it. And so that's of the bowel, the screening of the bowel. But also, I would have an endoscopy for my stomach for checking for that cancer there. And I ended up actually with at one point with H. pylori, which is a bacteria which causes ulcers. And the ulcerated areas, there were two precancerous areas in my stomach. And of course, they were removed at the time with the scope. And since and I was treated with antibiotics and fine since then, and of um, some other areas after did show up. Also, I get screening twice a year for my skin. I have had skin cancer. Um, I mentioned my sister. She also had skin cancer, but she's since passed away from another entirely different condition. Uh, but interesting enough, she ended up in a nursing home, and I used to visit her. But I never did want to let her know that I had skin cancer because I knew she would be very uh, well traumatized by it because our relationship was very close, and uh, so I never told her, and I was making up lies, excuses as to why I couldn't visit her and things like that while I was being treated for it. So it does have an impact in many ways. I think the knowledge is the important because, like I do get screening in my skin, my stomach, my bowel, my bladder. Um, and all these things, that happen every year or so, or every 2 years now, it keeps me aware of exactly what my health status is. And I also make sure that my lifestyle is such that what I eat and so on like that are known to be things that are more healthy. Try to avoid the things that are known to be probably cancer risk, because I think that's, the genes is there, and I think that environmental things, or when in the environment externally, or what you bring into your body, probably has an impact upon that gene. Now, Jane could probably describe that better than what I could, I'm sure. But when I look at it, I have some control over my health, which is very important because of the screening. I have that control. I also have, that can control my diet and my other parts of my lifestyle to probably keep me healthy. I
Thank
hope.
you. Thank you. Thank you. So no, absolutely fantastic points that we would often miss in the maybe scientific literature. Um, Thank you for again emphasizing on the impact. Survivorship is very complex, as you say. There are personal preferences, people to protect or people to talk to. So, there's nothing right or wrong, I think, in how we approach to it. But I also was struck by the fact that, when your dad passed away, and then, when you express the screenings, and your the situation with your sisters, not telling her because you were concerned. So you would think that we would have mental health support or support for survivors to deal with this kind of things much easier. I think there are some, but they are not very well known. Maybe this is a good time right now to tell a little bit about the Provincial Cancer Care Program, which is really fantastic, and it oversees the cancer prevention, to cancer screening, to cancer treatment, and cancer survivorship program. So if anyone is interested in, please Google it, Provincial Cancer Care Program, and you are going to see a whole bunch of great services. And the other source that I want to mention is the Dr. H. Bliss Murphy Cancer Care Foundation. They also have certain types of patient and family support programs. And of course, other organizations include the Canadian Cancer Society. So if anyone is interested in learning more about the support services, screening, etc., available to them, they may want to contact those organizations and maybe more.
Septak, there's just one
Yes.
point I'd like to make.
Yes.
I think what's really key in the support system is having somebody to contact. It's one thing to have screening and you have it every 6 months or every 12 months or whatever the recommendation
Yes.
is. But as a geneticist, you say to people, and if you have any symptoms, let us know. But there's no telephone number
Yeah.
attached
Yeah.
to the
Yeah.
us. There really needs to be a nurse, a number that you can call, because if you may be having your screening and you've gone for 5 years and nothing else has come up, but then you do have abdominal pain, you
Yeah.
do have, you see changes in your skin, you have in women in breast cancer families, you actually find a small lump. You can't just wait 6 or 9 months till your next appointment. You need to talk to somebody right away, and this is where the cancer clinic is helping to have somebody. But there needs to be that telephone number, somebody answering the call and making sure you get to the right services.
You are absolutely right, and I'm very familiar with Dr. Holla Echegary's study, trying to have nurse navigator, I think, system for hereditary cancers in the province, which will be really fantastic. Fully agree, and those I think I'm not a patient, but maybe Derek would also know the patient navigators. I think it's one program that everybody agrees is fantastic.
Yeah,
Uh,
there are. I have a good friend of mine actually
mhm,
really started up the Nurse Navigator program, but it's for cancers in female cancers,
mhm,
uh, and unfortunately for my particular condition, because I don't actually have one of the cancers presently, I I've tried to have a navigator because I just wanted to have someone I could speak to. And I was told, well, unless you're actually actively being treated.
mm,
I do have a cancer now, but I'm not being treated for it. There's no
mhm.
treatment necessary at this point.
Okay.
Uh, but you know, I think as Jane said, having that connection, uh, because it's an overwhelming thing, I think, for many people
Mm,
when they learn they have cancer and they don't hear if in a doctor's office what might be said to them. They just hear the word cancer, and it you know, it just hits them so hard. Uh, but you need to have a bit of time to, I think, to absorb the information. But then you need to have that person you can follow up with. Uh, and unfortunately, now I'm in several support groups, one
mhm.
provincially, one nationally, one internationally for the type of cancer that I have. So I have that, you know, that we can talk about, you know, our treatments and how things are going for us and so on. Um, and I'm on what's called active surveillance at this point. So I'm just being watched carefully every year or so. I have to have, you know, extra work done and that sort of
Yeah.
thing. Um, so I don't know if you want to enlarge on that, Jane, or CTAP, whether you think that the nurse navigator situation, we need to probably improve on that.
I,
Absolutely. Yeah.
yes, I think so. I mean, that didn't really exist at all.
Hmm.
And there really wasn't somebody for people to call. If they called the family doctor, the family doctor wouldn't really know what to do in the, for each cancer situation or other medical condition. And so you need that person with all the resources to be able to make a colonoscopy appointment, even though it's 9 months before your next scheduled one, or to be able to do some blood work, or check the skin to check things out. Because the whole point of screening is to find things early. And so you need to be able to have some way to act on those findings right away. And
Yeah.
so nurse navigators didn't exist before in the cancer area, and now they do, and they're increasing, and they're a wonderful
Yeah.
addition
Yeah.
to medical care.
Yeah, and I think there is a couple of outside of St. John's as well in Central Western as well. So these are great. And I also know that I think there is an Indigenous patient navigator program as well, particularly, serving the Indigenous populations. So there's again a great service. Hopefully their number will increase because I haven't heard anything but, all the positive things about nurse navigators and nurse navigator programs. So this is really amazing. Um, Maybe it's a time to actually say a little bit more about the cancers. Jane, you made good points about, cancer is actually common. Yeah, the current statistics is around 43% of all Canadians are expected, and oftentimes it's considered old folks disease. Like 9 out of 10 cancers are detected in individuals 50 or older. But, there are still a lot of young people younger than 50 who are affected. And we talk about, hereditary cancers. So age of onset can be early because, there is already some gene in, increasing the chances of developing cancer. But sometimes if so what are these, like, let's give an example of hereditary cancers, for example, like colon cancer we mentioned about, right? Hereditary colon cancers, there are a number of them. And
There,
then breast and ovarian cancers, gastric cancer.
there's also various blood cancers, but
Yes.
there are some specific conditions, and they're of particular importance in Newfoundland. One is called the multiple endocrine neoplasias. Now,
Mm,
neoplasia is really a sort of a term for cancer. Um, Endocrine, those are the organs in the body that produce hormones. And so it might be the adrenal gland, the thyroid gland, parathyroid, pituitary, and so on. And in that particular type of cancer, those are, rather than in the colon or the stomach, it is those endocrine areas.
mm,
And so they have separate screening programs. And again, it was a situation of looking at the families and documenting everyone with cancer, the age they were, the how advanced the cancer was, and working out, talking with the medical specialists, how can you find something in the thyroid earlier?
mm.
Is a blood test going to be helpful and all you need, or do you need some kind of imaging? And so those screening programs change over time as new investigations become available.
Yeah.
A long time ago, we used an ultrasound for looking for tumors, and then CT scans, and then PET scans or MRIs.
Yes.
But it's always which is the best one for the situation. And so things may have to change with time. So there always needs to be oversight of the screening program. And the other thing is that in Lynch syndrome, it was hereditary colon cancer. Well, no, it wasn't just hereditary colon cancer, but somebody had to look at the records and so on and see that many of the women didn't have a colon cancer or didn't have it first. It was endometrial cancer.
Mm-hmm.
And so all of this work had to be done with reviewing records and seeing what kind of tumors, or somebody else might have had abdominal surgery and it was appendicitis. And so that wasn't part of the cancer situation. But the one question, cells are what make up all the organs of our body, whether it's the skin or the lungs or the heart or the colon and so on. And they are the critical foundation of the human body. and they are supposed to divide at regular intervals and so on. And cancer is when the dividing happens too early and too often.
Mhm.
And so you're getting multiple cells rather than just replacing old cells. You're
Mhm.
making new cells, and it's that group of new cells that really is the cancer. And so over time, there's been a tremendous amount of learning and um, labs and hospitals all over the world. And there have been some important contributions from Newfoundland because of the large family size and the fact that we could learn things that in when there's families of just one or two or three siblings, you can't put
Yeah.
the information together like we could
Yeah. So
here.
we thank all those families who helped find the root cause of these symptoms, who are now helping a lot of other folks.
Yes, absolutely. The
Absolutely.
families
So
were
thank you.
critical, critical.
Thank you, everyone. So I'm very aware of the time, but just before we go to the closing, I wanna just iterate on what Derek has said. You try to take care of your health by, being healthy as much as possible, by going to screening and etc. Your message is really powerful. Like in your case, I think in your situation, um, your risk is modifiable, which means that even though you may have the gene, you don't have to get all the different organs affected by it, right? This is my understanding.
Well, that's my understanding as well.
Yeah.
And the age is another thing. Like I said, my father was in his 20s. I've known people, other people in my family who've died in their 20s from a cancer, and other people much, much older. But again, the screening and keeping on top of things. The aunt I mentioned earlier, she had first had cancer in her 30s, but she died at home in her own bed at 86. And through her lifetime, she had many cancers, but thankfully, because of the healthcare system and her diligence, and I guess the diligence of healthcare providers as well, uh, she was able to overcome all those episodes of cancer she had in her lifetime, and which was a wonderful thing for her.
That's an amazing message to folks. Like, seriously, I think it says a lot of things. One, but I got three, I think. So diligence of the person, diligence of the healthcare providers, and advances in science and medicine all working together to, reduce our chances of getting this disease. Hopefully, some of us are living, long enough to die because of other causes rather than cancer. So these are really great messages because, we need to emphasize that cancer is not most of the time, it's not a death sentence anymore, even though we are all very scared of hearing it because in the past it was seriously, our medical system wasn't there, accessibility wasn't there, screening or better treatment option. But over time, things are really improving. Hopefully, it will improve much better, much faster, and for everyone, because not everyone can get the medical care. We know that, including screening and treatment and so on. But this is a topic for another conversation. But yeah, I forgot what I was going to say, but it's really powerful. Like we really need to, if you can know. Oh yes, the cancer, we are controlling cancer much better today than yesterday, and tomorrow will be even much better. So I think together with your powerful, hopeful, great positive sentences, Derek, this is what I want to emphasize here. Please be in the know. Please be diligent. Hopefully, your healthcare providers are also diligent. We have much better treatment, screening, early detection, and other support systems available. We all may be scared of the term cancer at the beginning, but just know that you are not alone. There are a lot of support, and the chances of surviving disease is much better than before. So hopefully, don't just keep this in your mind. So with this, yeah, with this, so maybe I think we have been talking for like maybe 40 minutes now. So it feels like we can continue more, don't get me wrong. But if there are any final things that you want to say, for example, Jane for the next researcher and Derek for the next patient.
Well,
Um,
well, one of the things is to basically, uh, for the individual who is affected, to keep on top of it.
mhm,
You have screening and you're waiting for a result. You shouldn't just assume that no news is good news because sometimes things get missed in the healthcare system as well. And so after a period of time, I know my people have done screening with me will say, well, if you don't hear from us in so many weeks, call. And that's important because we have to keep on top of it. We have to advocate for ourselves as well. And, because the system is very busy, so we recognize that.
yes,
And
yes, for sure.
I think we've come a long way, certainly since my father's time and his first cancer back in 1949.
And
Thank you.
I think the that relates to this is that just because of advances in medicine, new medications, new ways of examining, screening methods are changing. So the right screening 10 years ago is not necessarily the right screening now, or what now
Mhm,
may not be
mhm,
what you should be doing in 5 or 10 years. So
mhm.
that's why you need this ongoing contact with the medical care people who are knowledgeable about
Mhm.
hereditary cancers. Is there something that's a better screening test or
Mhm.
better way to examine? So always, then you can keep up to date
Yes.
and have the best care.
Thank you. And I'm going to say, I just want to emphasize that, folks, if you have any symptom which you can't explain, please go see your doctor and, try to get an answer for the root cause because some of the cancer symptoms may be so unspecific. For example, losing weight, anemia, and constipation and this kind of stuff. But sometimes it just, sometimes it may be really not important, but sometimes it may be an indication of a tumor forming. So if you have any symptoms, regardless of your age, please go see your doctor. And even though if you don't have any symptom, we have wonderful population level screening programs, and these are exactly why they are designed for. At the beginning, Jane also said that screening programs allow us to detect tumors or cancers before there is any symptom. So in Newfoundland and Labrador, there are a number of screening programs. I just basically want to again refer to the provincial cancer care program, and you will see there's cervical cancer, breast cancer, and colon cancer screening programs available. And I believe prostate, thyroid, and skin cancer screenings are also possible, even though it's not at population level. So please talk to your doctors. They are the best person to give you the best advice, but also know, the screening and other important information that will help you to protect your health and decrease your risk or increase your treatment success. So with this, Jane and Derek, I couldn't be happier. You are so fantastic, and I seriously feel like we can continue for hours. Maybe we will have another episode, but I really want to say thank you. You are amazing, and just we just decided to do this in the last half an hour before we started our conversation. So this is amazing. I don't think anybody could be as lucky as I am or feel as lucky as I am feeling right now. So thank you so much. Hopefully we will see you next time. And with that, I want to say, folks, please take care and see you next time. Talk to you next time.
Bye bye.
Bye. Thank you. I mean, you need a team like this, the families, the geneticists, the medical care team, um,
Absolutely.
to have the best care.
Yes, you're right. And best conversation as well. So thank you for being a part of it. This is absolutely fantastic. Derek, Jane, I can't find the right words to thank you. So all
Bye
good,
bye.
all great.